Hey babes, welcome to Stoned and Horny, the podcast all about exploring and expanding your knowledge in sex and cannabis with experts and friends. I'm your host, Hayley Herms, and today we're talking about intersectionality in sex, pelvic health, sex counselors, and plus-size sex and fetishes with our special guest, sex counselor, pelvic physical therapist, professor, and author, Dr. Uchenna. Did I say that right?
You said it perfect.
Beautiful. So I guess we're just gonna jump into it.
Off and poppin'.
Yes, we're off to a great start. You have great energy. Can I ask you what's your sign?
I'm a Scorpio.
Oh,
yeah.
I wouldn't have guessed that.
Right? No one guesses
but
that.
But with the sex, it makes sense.
Oh yeah, yes.
Yes,
it makes perfect sense.
So now we interview's over. We understand.
Yeah,
everything.
it's all settled.
Yes,
it's all settled.
Yeah, but so I guess we're just gonna dive in the terms of, like I mentioned, you are a pelvic physical therapist, but before we dive into that, when we were kind of pre-chatting, you made me aware of, to get to that, we kind of have to talk about intersectionality and sex.
Yes.
So if you could kind of explain to us, we're kindergartners, the listeners, what that is, why that, I mean, I know it matters, and but what does that break down to be? And then we'll dive into how you got there to pelvic health.
Absolutely. So
yes.
I think the first thing when we think about intersectionality, it's the lens in which we need to look at all of our lives, every single human in this planet, right? So for me, I consider myself a Black, cisgender, queer, female, right?
Yes.
And so, but I'm plus size, I have short natural hair, I am first generation American. And so all of these identities that I inhabit color and actually shape the opportunities and resources available to me. And there is a different level of stress with each identity, right? So it's a different level of stress that you experience if you are a lesbian, if you're bisexual, if you're gay, but then if you're differently abled.
Yes.
Right? If you have a blue collar job versus a white collar job. So the way that we think about intersectionality is that our different identities look at how oppression plays in our lives and how not only we receive those resources, how we access those resources, how we're treated in society. And it's all intertwined with capitalism, sexism, racism, all of the isms. But that is the way that we need to start looking at our own lives. And for me as a healthcare provider, I'm looking at through that lens for every single one of my patients. So it's not just, it's not just about racism. It's not just about sexism. It's not just about classism. It's about all of those pieces and how they fit into that person's life and how it impacts not just their emotional health, but their physical health, their sociocultural well-being, their interpersonal health. All of it.
It affects everything.
It affects everything. And the intersectionality was coined by Dr. Kimberly Crenshaw, and she's a legal scholar, and that was back in, I think, mid-1980s when she was at University of Chicago Law School.
So that's just not that far off.
No.
This is just coming to be. And I know that has to pertain to, we're talking about it in a sex sense, but I also feel that's kind of how I approached finding a therapist.
Right.
I was going to therapist, and I was really getting why isn't this working? And then finally I woke up one day and was I need a therapist who can understand the qualms of A, being a woman. So I'm oh my God, why have I been seeing all these male doctors? And then B, just having fat or plus size or just eating disorder experience and all of that. Whereas all those male doctors, male white doctors, they couldn't even comprehend. They're not saying that men don't have body issues, but they didn't have any experience with it, or they didn't have any clients that were experienced what I was experiencing. So I'd go in for advice and they'd be totally worthless. So that, I feel that's kind of how I approached finding a therapist. So I think especially with the work you do, that it goes so much deeper because you're now, I don't know, sex is a mind, body, soul experience, and you're touching on so many different things.
Many things. So when you think about the archetypes, so let's use Black women as an example, right? And you look at the archetype of the mammy, right? Or the superwoman or the angry Black female. All of those have different identities in terms of accessing one's sexual being and how society views them as a sexual being.
Wow. Wow. It breaks down even
right? And so
deeper.
You could do that with any racial group, any ethnic group. You could do that with any individual, and think about how closely that ties into policy that is made. So it's not just, pleasure. It's like, well, pleasure can be accessed in different ways. Pleasure can be accessed in like how you're able to achieve financial success, professional success, emotional success, all of it.
All of it.
All of the things.
And that's how you incorporate that. Is that like the first discussion you have when people come with you to pelvic health?
Well, the thing is, I meet people where they're at.
Okay.
My job is to give them permission or give them the opportunity, well, first to tell me their story.
Okay.
So I'm not going to put my understanding of this concept on them if they're not there. It's more about opening their eyes to the possibilities within the context of their story.
Yeah.
So if someone's coming to me with pain with penetrative intercourse, and they're saying, well, this has been my issue. And I go, when was the last time you had penetrative intercourse without pain? They're going to say, well, never. And then they may come from a religiously conservative background. They may be, English is their second language, is not their native language. I count acculturation. I account all of these components. So I'm not just going to be there and say, you deserve pleasure. Pleasure is your birthright. Yes, that's true. But I might have to approach them with, okay, let's talk about your anatomy, because it seems like that seems to be a big gray area for you. So let's get that clear. And this is what I'm going to do to help you today.
Yeah.
And then we make building blocks.
Yeah.
And then over time, even the things that I look at, it's not just, I'm not going to not just measure their depression and their anxiety. I'm going to measure, yes, if they're having incontinence, pain, but I'm also going to look at discrimination. What's the daily discrimination scale? And some people will ask me, why are you measuring discrimination when I'm filling in back pain and all this stuff? Because that impacts your health. Because that stress gets internalized, and your pelvic floor is a truth teller. Your pelvic floor is a truth teller, my friends, okay? If you can't consciously process it, trust me, your pelvic floor will.
I believe it. Like, to me, it was just kind of mind-blowing in general, because I had no idea that you could have a physical therapist for your pelvis.
Oh, yeah.
And but that makes sense, because I'm like very spiritual, whatever. And when I think about the chakras, we have like the sacral chakra, which is like basically the pelvis area.
Yes.
So I can see how those two like align and like come together. So my question is like, how did you like even discover like you wanted to do this? Like, how'd you get into it? Like, because I assume you didn't wake up one day and you're like, pelvic health.
Like, I wasn't like, yes, I want to deal with pooping and peeing and sexy time and prolapses. No.
Yeah, because it's not just sex. Pelvic health is like such a wide range of things.
Absolutely. So I see people across the gender spectrum with everything from after they've had their prostate removed and they're having incontinence or erectile dysfunction, to people after they've had babies, to prolapse issue, constipation, endometriosis. So all pain related to endometriosis. So all of those components. But I was in high school. And I had 2 internships. One
in high school.
In high school.
Oh,
yeah.
You were like out here.
Yeah. I mean, I'm Nigerian as. Okay. Can I cuss?
Oh yeah.
Okay. I'm Nigerian as fuck. So my family were all like extra about about things.
Like you should know what your career is.
Well, my parents were actually pretty cool. They were very supportive. They just wanted us to pick a lane.
Okay.
Right. My mom's like, if you want to be an artist, great. Then you're going to go to the best program to make sure that you be the best artist you can be.
Yes.
You want to be a garbage collector? Perfect. Then you go to a trade school that will make you the best garbage collector you can be. So they just wanted excellence in whatever we did.
I love that.
And so when I was a teenager, I told my mom, I said, I want to go to school out of state. I grew up in Dallas, and she was like, well, we don't have money for that. So you're going to have to get internships and like get scholarships and all that. So that was my first internship. Going into my sophomore year was with the Dallas Cowboys, and working in there with their CFO. Okay. And then with this physical therapist that I thought was a sports therapist, because I played soccer. Okay. And she turned out to be, her name's Kathy Tisco, and she turned out to be a pelvic health physical therapist. And I worked with her for 3 summers, and I just fell in love instantly.
Oh my God. I mean, I can imagine that like a sports team would have that, because it's connected to all their limbs. And
I thought it was a sports internship, but
Okay.
it was really just pelvic health. I just did, because I didn't know physical therapists did that.
Yeah.
So, and I was 15. I didn't know. I had no idea.
And then from there, like in college, did you go to college?
Yep.
And then
Yep. I went to Boston University, and I ended up getting a degree in rehabilitation counseling, and I did research for a couple years. I went kind of a different path, and then I was like, yes, I definitely want to do this.
Okay.
And so I went to got my doctorate in physical therapy at University of Illinois Chicago, and then I went on to do a residency, and then more in pelvic health, and then more postdoctoral training in sexual health.
Oh my God, queen. Is there any like tips, I guess, you could give us on both spectrums of like what are some signs showing that I should go maybe see a pelvic health therapist?
Absolutely.
And then kind of like tips of like, is there anything I can do to maintain like a good pelvic area?
Sure. So I want everyone to think, like, let's first talk about like what the pelvic floor is, right?
Okay, yes.
So the pelvic floor are the muscles at the bottom of your pelvis. So they attach at your pubic bone all the way to your tailbone, and they hold up all of your organs. So your bladder, your uterus, your rectum.
That's more intense
right?
than I even, yeah.
Exactly. And its job is to pump blood back up to your heart, but then also to help you with urination, defecation, sexy time, and babies if you so choose. But it also pumps your lymph fluid into your inguinal lymph nodes.
Okay.
It also is really, really important to stabilize your spine and your pelvis. So when people have chronic back pain, one of the things that can be missed is pelvic floor muscle dysfunction. And so what we have to remember that your pelvic floor is a muscle, so it needs to contract. It also needs to be able to relax and lengthen. So it needs to be coordinated. So if you're squeezing, you should be squeezing, and then you should be able to let go. And if you're pushing, you should be pushing. But sometimes our patients will squeeze when they think they're pushing, and they'll push when they think they're squeezing.
How do we know the difference?
Well, that's my point. So that's why I don't ever blindly tell someone to, let me rephrase. I never recommend that someone do Kegels without a proper physical assessment.
Okay.
And so, because I don't know what your muscle's functioning at. Like, your muscle could be like this, and you don't even know.
Yeah.
Or your muscle might have really low tone, and you may not even know. But even then, for some people, doing Kegels, they might need it to be guided. It's almost like having a skilled trainer for your pelvic floor, but you have to remember there's nerve function is important, blood flow is important. And so there are lots of things that go into that.
Yes.
And so I would tell people that if you are struggling with constipation, bowel issues, urinary issues are huge. So everyone thinks, oh, it's normal if I leak when I cough or when I jump. And it's like, well, it's a common problem, but it's still a dysfunction.
Yes.
And so if you leak when you cough, laugh, sneeze, jump, you should probably see a pelvic health physical therapist. Or if you're not able to access them directly, go see a urologist who focuses on your genital area.
A urologist?
Yes.
So what's kind of the difference between a gynecologist and a urologist?
So a gynecologist is doing residency in obstetrics and gynecology. So they're focused on the female reproductive system.
Okay.
And a urologist is focusing on the urological system. So your kidneys, your ureter, your bladder. But then you also have a specialist who is called a urogynecologist. So they've done residency training in obstetrics and gynecology, but then they do another 3-year fellowship training on the urological issues and also the pelvic floor issues that happen in women and non-binary folks with vaginas and uteruses. So prolapse, incontinence, those type of issues.
Okay.
So you can
That's good to
see
know.
any of those 3.
Okay. Because oh my God, this is so embarrassing. Like, well, it's not embarrassing. We're taught, this is, this is why we're here.
This is why we're here.
But I didn't think I'd say this, but like, I would like cough or like whatever and like, oh my God, pee a little.
Yeah.
And then like, I went to a doctor, but I don't think it was any of those doctors. And they were like, your vagina is, or like whatever in there is too tight. Like, you're like, what, like, it's just like, it needs to like,
relax.
yes. And but they didn't tell me how.
Right.
And like, so I was like, okay, but here I am, like the Kegel Master 5000, just doing Kegels all the day. And I'm just making everything worse
And
because I feel like social media sensationalizes,
absolutely,
like, do your Kegels, but actually, like, I guess my Kegels are working against me now.
Right, exactly. Because imagine like having your fist clenched all day.
Oh my God.
Okay.
It would hurt, like spasms.
Right? And it's like, okay, yeah, now open your hand.
Oh.
And that's what your poor little pelvic floor is going through. And so I always tell people that your pelvic floor is part of a team. So your abs, your glutes, your leg muscles, your diaphragm, they all need to be working in synergy.
Okay.
And so one of the things that I may even start someone like you with is diaphragmatic breathing. So making sure that when you inhale through your nose, you're going to inhale through your nose, exhale through your mouth, but you're going to have your rib cage expand, your belly expand. Everything's going to just expand open as you inhale.
Okay.
So you should feel that rib cage expand on that inhale.
Yeah, like right here.
Yeah,
okay.
But then you should also notice your pelvic floor also kind of dropping down and expanding.
Oh my God. You don't think about it.
Exactly. And another thing you want to think about is like another thing some people do with leakage, especially when they're too tight, I tell people pee time is me time.
Okay.
So like relax your jaw.
Okay.
Relax your shoulders, relax your toes, let your belly hang, and just pee. A lot of people power pee. They're like, oh!
Oh
Don't
my
power
God.
pee.
I'm
Don't power
fucking
pee.
up my pelvic floor and I didn't even know.
Let her chill.
Okay.
Let her be.
Okay.
Sit on the toilet. Please sit on the toilet. If you don't want to sit in a public toilet, have your own toilet seat covers that you bring with yourself.
Smart.
But sit. Because if you're squatting over the toilet, your pelvic floor is like...
Oh, I'm going to tell my best friend that. She's like the squat queen.
Yeah.
Okay.
Yeah.
That would make sense.
Makes full sense.
And so did pelvic health, is that what got you into sex counseling? Or was it the same kind of time?
It was, so, I thought I was like the queen of sex. I'm like, I got this.
Yeah,
like,
I
don't need extra training. Like I'm comfortable talking about sex. And as when I was going through my residency, I was like, I don't know this. Like truly, to be a truly informed clinician in sexual issues, you have to address your own stuff first. And a lot of us across the healthcare professional spectrum, all the disciplines, it's not like we're getting robust sexual education.
Yes.
Everyone has that misconception.
Yeah, especially I'm guessing it depends a lot of like where you went to school,
where you
grew up,
right? Where you went to school, or where you went to grad school if you're a nurse or physician assistant, PT, OT.
Because as MD, you can imagine, most of America is taught like abstinence and stuff.
Well, it's a mixed bag. Some people have abstinence-only education. Some people have comprehensive. Some people have, hey, you just picked it up here and there. No one talked to them. And then they're going to med school. They're going to nursing school. They're going to PA school. They're going to PT school, OT school. And they're out here in these streets with these patients. They haven't even addressed their own stuff.
Oof.
And so I decided to do a training program at the University of Michigan. And it was a year-long program, and it was interdisciplinary with all folks across the healthcare scene.
Okay.
And we were just learning about everything from kink to our own sexual issues, how to counsel our patients on things. What are the factors in terms of like all across the gender spectrum, across the sexuality spectrum, like all the questions and things that we all think we just automatically know by just being in the identities we have, but that's just not the case.
Oh, yeah.
And from there, I learned, wow, I thought that I had dealt with all my biases, but I realized I brought them to the table in the way that I asked questions for my patients.
Oh, yeah.
And so that's a really important thing to understand is like 86% of patients want their healthcare provider to initiate the conversation, but a lot of the healthcare providers don't, depending on their discipline and specialty.
Okay.
And also because they're like, I don't want to make the patient uncomfortable because they themselves aren't comfortable. I always ask my patients.
Dude, I had a doctor that was like that once. Mm-hmm. And I was literally like thinking it was a gynecologist. Mm-hmm. And like, luckily it didn't turn out to be anything. I like accidentally cut myself shaving.
Yep.
But like, it burned for a minute. I was like, oh my God, I have an STD. Yeah. My boyfriend's cheating on me. Yeah. Like, la, la, la. And I go there and like, I'm like telling her what's happening, this and that. And she just prescribed me stuff and never even looked. And I was like, call me crazy, but I'm pretty sure you're supposed to like look at my vagina at this point.
Yeah.
And she never looked. And then later I like called her because whatever she gave me wasn't working or this and that. And she's like, yeah, I guess I should have looked when you were here. And which pisses me off because then to think about it like, okay, well now I'm going to have to pay a second copay.
Right.
Like, so
Which is a huge barrier.
Yeah. And like, and depending like who you are and like what your status is, like not everybody has the means to like keep going.
Right.
And so I just like, I really like that you said that you like handled your own shit first because I felt like had this lady, she done her inner work, it wouldn't like, I just couldn't imagine being a gynecologist who's not going to look at a vagina. Like that seems kind of like crazy to me. So I don't know, maybe, because then that makes me think about it. Like, is it like fat phobia? Is it like, I know I don't smell or anything, but like, is it like what is it? Then it makes me think it's a me problem. And so it's so interesting. Yeah. I'm having like a mind, like explosion right now.
Absolutely.
Like thinking about that and being like, oh, like that wasn't a me issue. It was most likely like a her issue. Thank you.
Yes.
Wow.
Yes.
Just come to Jesus moments here.
Yeah. I mean, we're all human in this. We're all human in this. I mean, I was a professor in a med school for the past 6 years. And I, taught at all levels, the med school level, the resident level, the fellows level. And I spoke on pelvic health, sexuality, all of that stuff to kind of normalize that conversation so that the patients that they're going to be handling, they're going to be a little bit better equipped than their predecessors.
Yes.
And that was the goal. But that was also a commitment to the department that I was in as well.
We love commitment.
We love commitment.
So can I ask why sex counselor over like sex therapist? Because a lot of people don't know there's a difference.
Absolutely.
And like, cause like we've had a sex therapist here before, but there's a whole different legalities and like things.
Absolutely.
And so like kind of what's the difference? Why one than the other?
Yeah.
And yeah.
So a sex therapist is actually not a protected term. I think it's, ironically, I think it's protected in the state of Florida. But a sex therapist is a licensed mental health professional. Okay. So they are going to be doing psychotherapy intervention. So they're going to be doing cognitive behavioral therapy, EMDR, all of those interventions that are really important to help with the deep, intensive psychotherapy. I am not a licensed mental health provider. So I'm not going to go into your family systems. I'm not going to be doing trauma therapy. I can be trauma informed. Ooh. So trauma informed is that I'm going to be transparent with you. I'm going to establish safety. There's going to be reciprocity and shared decision making. You're going to be able to feel like a full participant in your care. So that's trauma informed care. I'm not doing psychotherapy. But what I am as a licensed medical professional is I'm going to be getting permission from you to talk about it. I'm going to give you limited information and specific suggestions based on your diagnosis. So usually the sex counselor is going to be short term and it's going to be within your healthcare visit.
Okay.
And you're not going to see your PT or your OT or your doctor for 10 years on that same issue. Like you could be with your therapist for like forever, right? Yeah. But your therapist is doing psychotherapy. Yeah. And your doctor, nurse, OT, PT, we are going to be sex counselors. So we'll counsel you around your issue, but then we may get you to a point where you're like, great, your goals are hit, your orgasms are there. But if you're like, oh, my orgasms are they're a little bit better, but I'm really having a lot of anxiety or I'm really having a lot of pain over my partner cheating on me and I need to work through that. Then that's when we're saying, okay, perfect. We've kind of hit the road in what we're going to do. So we're going to take you all over to our colleague who's going to help you with the anxiety. Okay. Who's going to help you with the trust recovery for your partner so that you can actually open up. But you have all these skills and tools. So when you are ready, it's just going to be like a sexy wonderland.
Yes. So you would essentially like want to see like a sex counselor first before you go to like the therapist.
You can. It just depends because sometimes I think from our perspective, if I'm seeing a patient, for me personally, I will work with them for a while. So I'll understand, okay, you know what? Actually, they may not need sex therapy. They might need therapy for their depression. They might need therapy because they're going through this transition, which is impacting their sexual functioning.
Got it.
So my eyes are astute to that, and then I can say, oh no, they definitely need some sex therapy because it's wrapped up in some type of trauma or some type of work they need to be doing, or some, whatever themes that are not part of my skill set or training.
Yes.
But then I can still address, and I can work, and I've worked side by side with sex therapy.
Okay.
So in the context of being a physical therapist and doing sex counseling, I'm giving them education. I'm teaching them how to use their dilators for their pain issue or whatever intervention I have, and still give them that. And then they can take that education and say, okay, I have this knowledge base on the back end, and then they can work on the deep psychological component with the sex therapist. It's a lovely marriage.
Yeah. Oh my God. So are you like licensed in one state, or could like any, okay.
So I can see people virtually, which is awesome. So I can see people internationally, I'm licensed as a physical therapist in the state of Texas.
Okay.
So I will practice physical therapy in the state of Texas, but I can counsel you from anywhere.
Okay, that's beautiful. Just, just so the listeners can know, just in case, you're just like so full of knowledge. Like, I would trust you so much if you were my physical therapist or sex counselor.
Oh, thank you.
It would just be amazing.
Thank you.
So, I mean, you've got all these years of knowledge now, which I'm guessing leads up to the moment of the conception of your ebook.
Oh, yeah.
Your books.
Yes.
Sex Swagger or Sexy Swagger?
Sexy Swagger.
Sexy Swagger. So can you tell us what's in the, or like, we'll read about it, but give us a little.
Yeah. So the book I created, on social media, right? With UC Logic, my brand, I focus on sex ed for the adult. And I have this thing called Sexy Swagger Tips.
Okay.
And it's just basically my advice over the years, dance with like no one's watching. I mean, I didn't write something like that, but something similar to that.
Well, when I was looking at your page, like when I was, because a lot of people like reach out, want to be on the show, but not everybody's like a fit. And I really look for people who like know their knowledge and what they're doing. And so one of the things I loved on your social media was that you were like giving these tips and like they just one-liners here and there, but it was like, oh my God, like I had no idea.
Yeah.
Sorry, continue.
No, it's really important to me that people have value from what I do.
Yes.
I want them to be able to walk away and say, okay, that was really helpful advice. Let me see how this works. And at least give them courage for that. But this book is basically an aggregate of all of my top 10 swagger tips over the past 6 years.
Okay.
And I use it as a framework to help people reinvent their sex lives, to help reset. And it's geared towards women and non-binary vulva owners. But we start talking about the biopsychosocial model, intersectionality, developing a sexual philosophy that works for yourself. So we start there, almost taking a Polaroid of where you stand before you do the ebook, because it's more like a workbook.
Okay.
And then as you work through all the steps about really identifying who you are, what you want in your sex life, and what needs to happen. And then at the end, you have all these resources. You do pleasure mapping. You do all types of fun stuff. And if you still want more support, you can always reach out and book some sessions with me.
Yes. So it's for like this touching on the sexual philosophy.
Yeah.
Is that just like a motto or like what like? Yeah. That just sounded really cool. So I thought I'd ask.
So it's actually something that I had to do as a clinician when I started my training, when I did the Michigan program.
Okay.
And I was like, what the hell? A sexual philosophy? And I remember thinking about that. And I'm like, wow, this is my personal sexual philosophy. Is my professional sexual philosophy. And over the years, I've evolved my personal sexual philosophy, right?
So
it can be how you want to engage with sex.
Okay.
Sex, sexuality, your sexual health. And so for me, there's always this understanding of safety and protection.
Okay.
That starts with me.
Okay.
And being and engaging it with other people. So my sexual philosophy isn't about the other person, it's about me.
Okay. Ooh.
And that's really interesting. So oftentimes what I see time and time again, particularly women, is that they'll attach their sexual likes, identity to the person that they're with or the people that they're with.
Okay.
And then they're like, why is my libido in the toilet? Why are my orgasms like hitting a glass ceiling.
Yeah.
You know, and it's like, well, because you're not engaging in things that maybe don't blow your skirt all the way up or blow your pants all the way down, right?
Yeah.
We're not even engaged in that mindful practice because we haven't been given permission. Society didn't give us a permission to be like, yes, please masturbate, touch yourself, figure out what works for you. It's an evolving process.
Yeah.
And so when we think about the concept of sexual philosophy, it's quite, I think, novel in a way, because then you're saying, okay, my sexual philosophy might change if I have surgery. If I have, because I had fibroid surgery a few years ago, and my sexual philosophy changed after that because my body changed.
Okay.
Right? I have this big old belly scar now. And it's like, it's
embracing.
It's like, and it's like, it was different. My stomach looks different. My stomach behaves different than it did prior to the surgery because I had this like 12-pound tumor inside of me.
Oh my God.
Mm-hmm. And so
you're okay.
I'm okay. But like, it was a thing.
Yeah.
And I just remember thinking to myself, I want pure joy.
Okay.
Like full joy in my sex life. And it's interesting because when I thought about that, that was never central.
Okay.
And I mean,
can I ask, like, what was it before?
I just didn't think about sex and joy as joy being the central part of sex.
Okay.
I kind of put like pleasure, and everyone thinks that pleasure and joy are the same thing. They're not.
No.
I wanted to feel elated.
Okay.
I wanted to feel as light as I felt when I got those tumors out.
Okay.
I wanted to have the type of sex that was like, yes, bitch.
Like you're smiling afterward.
I'm smiling.
Like you go to the store and everyone knows you just got laid because you're glowing so hard.
You know that black men frolicking on social media? Like literally every time I see that, I like get tears in my eyes because that's how I want sex to be. Like, I want to be frolicking and be like skipping.
Okay.
Skipping to the grocery store. Skipping, right, to the beach, to the pool, whatever.
Like floating. Walking on water.
Yeah, like this girl got laid down.
Do you have any tips? Like, because I know maybe joy's not everyone's sexual philosophy, but like, is there anything you do to like try to get that joy specifically? Or is it just kind of something like you have to feel with a partner and like,
I think it's a little bit of both. I think the first thing is that we have to recognize that your philosophy is not a static thing. It's going to evolve. It's going to change. Just like what you like, what you need is going to evolve and change. But it does make me more mindful about what my body is experiencing when I'm around certain people. Okay. Right? So if I'm about to like hook up with someone, I'm much more likely now to be like, I don't want you to do that.
Okay.
I just want to make out with you. Okay. Or I just want you to play with my breasts. Or I want to do things like, but I don't want you like entering me.
Yes.
Because that's not going to bring me joy.
Yes.
But I think I'm going to play with this and see if joy gets cultivated. And if not, I'm good.
Okay.
And if it does, then okay, yeah, then I feel good.
Yes.
But that's kind of how I cultivate that.
Okay.
But I also don't center penetration as the be-all, end-all of a pleasurable, joyful sexual encounter.
Definitely.
I tell people that I think when people focus on like penetration, particularly in heterosexual couples, it's almost like, I said this recently at a conference, it's like going to Chili's and you can only order a burger, but it's like, I'm a Golden Corral bitch, so I want chicken fried steak, the soft serve, the collard greens, because you want to pick and choose, and some days you only want to go to the salad bar.
Yeah.
And some days you want all protein.
Yeah.
And some days you just want yams. Ooh. Like all of it is juicy and yum yum.
Yes.
All of it.
Oh, I love it. I love it. Well, so speaking of that, as you know, we are both big, beautiful women. So I've been dying to talk about this with somebody. And like, you're just perfect. Yeah. And like, well, immediately when I knew we were talking beforehand, I was like, oh, she's got the vibe. So like, there's just, first of all, plus size sex. Like, let's just like newsflash, like fat people have sex.
Yes.
I'm comfortable with the word fat.
Yes.
I don't like, okay.
Yeah.
But like, there's not enough plus size sex scenes out there.
Nope.
There's like, no one talks about like different positions and this and that. And like, there's just so much stuff that goes into it, but then there's also a whole other world of like being fetishized.
Yes.
So it's like plus size sex in general, like there's just like navigating and learning your body and like being in tune, but then also like accounting your partner, like are they plus size, are they not? Like what positions are going to be more like good for us and stuff like that. And like I just kind of want to like, what's your experience being plus size and like having sex, like all across the board, or like never been a problem, or you tell me.
You know, I think I've been very lucky in that it's never been a problem from the partners I've been with. Like I've never received any type of abusive engagement in that capacity. It's more the abuse was internal. The abuse was internal.
Yep.
It was almost like, okay, well, I guess I'm going to, you know, engage with this person because like, you know, that's all I get.
Yes.
And that's like, you know, young college UC that was figuring out.
It's a common plus size like thought.
Yeah, like it's like,
community.
You know, and that's not the case, because I actually truly did not see people looking like me having sex with like delicious, kind, wonderful humans. But the thing is, you know, my definition of delicious isn't a skinny, rock hard person. It's just a person, a vibe, an energy. I love a thick, juicy man that's like big and fat, and I love a skinny man that's skinny. I love it all.
Yeah.
And I'm like, as long as like I feel that vibe with you and that energy, that's what I'm going to engage with.
Yes.
And so
you don't have a type.
I don't have a type.
Yes.
I don't have a type. I have a type where I need you to have the same values as me. If we don't have the same values, I can't, my clit is just going to be like going inside of itself, like a turtle's head into a shell. Like, so you can't, like, I'm not going to mess with you if you're like humanity.
Yes.
So we're not doing that.
Yes.
So, but other than that, I think I don't really have a particular type.
Okay.
I think one thing that has evolved is my appreciation of my body, especially as I've aged, because I'm fully grown. And I love the fact that, you know, because I looked at pictures of myself a few weeks ago, like 15 years ago, and I remember how mean I was to myself. I was so mean. And I was like, and the way I exercised and engaged with my body, it was like to like achieve the skinny status.
Okay.
And now it's like when I move, I'm like, I just want to be healthy. You know, like I say, I have cash money knees. My knees only work when Juvenile, the 504 boys, and like that's when my knees work. But otherwise, it's like creak, creak, creak.
Oh my!
Like
I always say
knees.
I don't got Megan knees anymore. After 25, my Megan knees said bye.
Listen, I think I skipped Megan knees. Okay. Like I don't think I ever had Megan knees, but that's the thing, right? It. But I think as I've evolved in appreciation of my body, you know, it's really about, I love that I can go on a hike and feel strong and like feel beautiful. I also feel, and I'm, you know, I'm a thick bitch, I'm a plus size bitch, I'm a fat bitch, however people want to define me. But I also kind of got into the appreciation of like lingerie. I used to think lingerie was for like only skinny people, like growing up. And then as I've, you know, learned about myself and learned about all types of experiences, and I'm like, gosh, you know, I really love the way it makes me feel.
Yeah.
I feel so empowered.
Yes.
And I wear it for me.
But also we didn't really even have those resources then.
We didn't.
It was like you couldn't like.
What was it? It was Hollywood. Something Hollywood.
Fredericks of Hollywood
was the only place.
And I think they only went up to like a triple D.
They only went up to a triple D. So I was
stuff.
Yes. Like spillage.
Yes.
And I was like, well, that isn't like what I was looking for. But now it's like, man, even I get it wherever now.
Yeah.
I'm like, Amazon's my jam though.
Okay.
Yeah.
You're finding good stuff on there?
I did. Avid Love.
Okay.
Avid Love. Yeah.
Okay.
Yeah, no, I think this other brand too, Yeah, but Avid Love for sure.
But yeah.
I found some good stuff.
There's a few, and then the Alomi we were talking about
Alomi
early.
bra. Oh yeah,
Yes.
their stuff is sexy.
Sexy, and the matching panties.
Oh yes.
I love Playful Promises.
Playful Promises is excellent.
Yes. So good.
Yes.
So good.
Ugh.
But I agree with you. I think having those tools, like now more than ever, to be like, okay, like I can look and feel like kind of like the girl in the movies without having to like look like her, if that makes sense.
Absolutely.
And I just think it's like just so important. Yes, you can feel sexy on the inside, but it's also nice when you can like play with it on the outside, kind of like what you would fashion.
Absolutely.
Yeah.
And I think that too, when we think about sexual positions as like a big girl, a fat girl, plus size girl, however you identify, it's really a position where you feel powerful. So people ask me all the time, what's a position where you feel powerful? They're like, what's the best position? And I'm like, it's a position where you feel the most comfortable and powerful. So some people feel really comfortable on their back. Some people feel really comfortable on top. Facing reverse cowgirl, facing. Some people feel really comfortable standing with their leg propped up. Some people feel really comfortable like on a wedge.
Yes.
You know, whatever, like some people are like, put me up in a swing, like whatever is going to make you feel like the fine ass human that you are.
Yes.
And feel celebrated in that. Right. And you want to, and I think that's also too, it's important when you're engaging with your sexual partner, picking a sexual partner. They're not like, you want them to honor you.
Yes.
Right? You want them to honor you and where you're at.
Yeah.
And I always tell people, you don't have to have perfect confidence to be in a relationship, to have sex or anything like that. But you do need to know yourself.
Yeah.
You do need to know what is it that you want to feel.
Yes.
So even if you're having a bad day, you're like, you know what? Oppression was extra today. I really could use someone to just go down on me. And that's it. And then bring me ice cream afterwards, or watch Madam Secretary with me afterwards. Like, because you want to feel that sense. You want to feel served, or you want to feel, you know, kind of just juicy. Or you may say, I actually don't want to be touched today, but I want to watch you take a shower, or take a bath. And I want to watch you lotion up. So it doesn't have to be.
There's so many different ideas of power. So many
different ways. And people don't play with power dynamics enough. Do you want to be, you can still be the leader, but you also can be the receiver. You can be the giver, right? And the follower at the same time. Like, it's like.
Yes. And especially like just like being plus size though, like some people like don't think like you can do X, Y, Z. And it's like, you don't know how flexible I am.
Exactly.
You know what I mean?
Exactly.
And so there's so many like stigma around it. And it's like, you don't know until you try. Right.
Absolutely. And sorry to interrupt, but I will say, don't underestimate the power of affirmations. And I used to be like, but it especially if you're on the struggle bus. Yes. The affirmations can be really, really helpful. Where you can be like, yes, like I love this body. Yes. And love doesn't necessarily mean that you're always happy about it. Yes. Right? I think that we have to kind of have room for that. You can still have love for yourself, and there are some days that you are having a harder time giving yourself appreciation and grace, and that's okay. So true. And I think that, you know, understanding what you're going to need in those days is really important. Yeah. I used to do a bunch of sex Q&As on YouTube, and one of like the most common thing was like, oh, well, what about my belly? Or like, what if he sees this? And I'm like, girl, like, or whoever, like if they see you, they already know what we're getting into, you know, it's just like minus a layer. It's like, but I would say, yes, the affirmations, because I'm thinking about it now. I'm like, I don't do like sexy or like body affirmations. I do a lot of affirmations, but that is something I definitely need to add on the list, because I think, I mean, that would help me, but I think a lot of those people that ask me questions like that would also help them too. Mm-hmm. Do you have like a couple favorite affirmations? Oh my gosh. So one affirmation that I like saying to myself is like, you are a delicious chocolate drop. Ooh. Your pussy is popping. Ooh. Your skin is hella juicy. Ugh. And you are sexy as hell. Amen. 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 Yes, I love that. Yeah. Well, so can I ask, I mean, I know you have this self-confidence and everything, but have you ever been like fetishized, and how do you feel about that? So I have been fetishized by, it was actually a boyfriend in college.
Okay.
And I didn't realize.
That's what I was just going to say. Did you know you were being fetishized at first?
Fetishized. And it was really like and he said it to me, it was interesting. Like he brought it up after we ate, and I was like, my belly was just like full. I was just like, I was just full. And he was like, and he just kind of looked at me like, arr. And I was like, I noticed that like he only wanted to have sex after I ate. After we had a big meal. Like interesting, right? And
oh my God.
And I didn't even really understand what a fetish was at that time. Yes. But I was also like, there's a pattern here. And he basically was like, yeah, like.
So you brought it up.
Yeah, I brought it up. And I think that I didn't like it. Like I broke up with him in those moments, because I was like, because I didn't appreciate, because at that time, first of all, he just sucked, but also but also, I didn't really understand myself yet. And so being in that situation, it was like very off-putting. Yeah. I think now, if that's part of your swagger, if you're like, I want to be fetishized, and that brings me pleasure, that brings me joy, that helps me access my power. If that's what you're looking for in your sexual play, fine. Okay. But if that's not what you're looking for in your sexual play, okay. So then so then have that conversation. And you don't necessarily need to be like, do you fetishize fat people? Okay. You can just start talking to them, and the way they talk to you and the way that they engage with you. Okay. Take your time.
Like, can you give me a little tip? Like, me personally, I would say I'm asking for a friend, but I'm asking for me. Yeah. Like, because like, I'll talk about my experience in a second, but like, after those couple experiences, I've now like tried to like gone out of my way to like ask guys like, oh, do you have a fetish? Like, have you ever dated a plus size girl before? But I want a way that's not so direct. Like, what would you say if you don't mind me asking?
Yeah, absolutely. So like, let's say, you and I are on a date. Okay. Like, you're the dude, I'm you. Okay. And be like, okay, so like what type of women do you typically date, or people do you typically date?
Oh, I like plus size girls, have a little extra something on them.
Interesting.
But I've dated skinny girls too.
Okay. And so why do you like plus size girls?
I don't know. I like the way their bellies poke out, and I like the rolls, and I like to hold the belly at night.
Okay. And what about skinny girls? What do you love about skinny bodies?
They're cool. It's normal and everything. It just doesn't get me off like plus size girls do.
Okay. So would you marry a plus size girl? Would you be in a long-term commitment with a plus size girl? Would you want to move in with a plus size girl? Would you want to share your life with a plus size girl?
Okay. Damn.
So I know that was direct, but it also gets you to that point where it's like, you want to be with me between the sheets. Okay. And again, if that's what you want, right? If you just want the sexy time, and you're okay with being the fetish, fine. But if you're like, you can also, I think it's actually okay to directly be like, I don't want to be someone's fetish.
Okay. Because that's, I guess, like, I don't know. It's almost like one of those things where it's kind of like gotta happen to you for you to know if you like it or not.
Absolutely.
It's kind of how it feels like. Is there a preventative way, or like?
I think the preventative way is, like, for me, here's what I do, right? Okay. I tell people, like, I'm a plus size thick bitch. Like, I'm no like size 2 chick. Okay. I'm a size 20. Okay. And that is me. And I'm good with that. But I also don't want to, I don't want to be the object of your fetish. Okay. And that has worked. Okay. That has worked. Okay. Like, I haven't, because I don't want to be someone's fetish. That's not for me. That's not my yum. It might be someone else's yum, which is fabulous. Yes. But it's not my yum. Okay. And so I say that off the cuff. And then I keep going through that process and asking in different ways and different styles.
Okay. So it's essentially, it's okay for a guy to have a plus size fetish as long as that's like what you're into.
If that's what you want, and if it's centering your humanity. Okay. Like, if you're dating to like be in a long-term relationship or something like that, and you want someone to like see you and understand you and feel you, then take your time. Okay. Have conversations. Okay. the more they're investing in you, the more they're talking to you. And then when you're engaging, it's like, yes. And there's a thing about, you'll know also when someone is talking to you from an appreciation standpoint.
Yeah.
Versus like, ooh, I just want to like, just say I fucked a fat chick.
Yeah.
Right? And it's like.
Or they're into fat chicks and they like can't like be like, you know, have it in real life. Like they wouldn't like take like a plus size girl around their friends or whatever.
Exactly.
Like, so, cause that was like when growing up, I think that was more of like a thing for me. I'd have guys all the time be like, you're so beautiful. You're so perfect. Like everything about like, but if you could just lose weight, especially like being in the suburbs, like, you know, I needed to be like a perfect like housewife type of whatever. And then like growing up, like also Catholic, it's very subservient of like everything's for the man, assuming that you're straight and like this and that. And so, but recently, like why this, I really wanted to talk about this was because I'm like, I just to an extent just started dating again after a while. Nice. And the first guy like I met like in like throwing myself back out there, we like dated for a few months, like everything was great, this, that, the third. And then, but he told me he didn't have social media. So I was like, okay, then I find out he has social media and I go to his social media and I find like, not only is he following people that follow like my fans, he's also following friends of mine. He's following BBW pages, like all this type of like fetishy stuff. And here I've confided in him before being like, oh, like guys like just want this or that or the third. And I felt so like taken advantage of. Like I felt like someone like robbed me. Like it was like so shocking to see this, and it made me think like a lot of things, like, are you only seeing me because I'm plus size? Like, oh, is this why XYZ doesn't happen? Or like, I mean, he was very like giving and everything in bed, so that wasn't like the problem, but it was just kind of like I've expressed my uncomfortableness with that, and like I had no idea. So then when I saw that, of course, like I just couldn't trust him anymore. Right. And then like versus like skip forward months later, somewhat ish recently, I was with this guy, everything was great, blah, blah, blah. And we had been dating, and then finally like the sex comes. But the sex, like he never told me he had a fetish. Like we didn't like really go too deep into that, but like the sex felt fetishy, like the rubbing of the belly and like the hit. Like there's like sex when you're like passionate in this and that, and then there's like I can tell you're paying too much attention to XYZ. And then recently, like I have OnlyFans. I don't do porn, but like I have sexy photos there. And on like some type of fetish site, my thing blew up. And so now I have all these people from the plus size, like fat fetish community and like the feeders. And I'm learning so much about plus size fetishes, because then I had this like internal dilemma, like, is this okay? Is this wrong? Is this and that? But like, honestly, like from our discussion today, I think that totally makes sense. Is like people having a fetish, because I don't like to kink shame or fetish shame. So that's why I was having so much like internal dialogue of like, I don't know how to feel about this. But I guess you're right. Like it might not be for me, but for some other woman, that might make her feel so powerful and this and that. So like, thank you for
You're
like
welcome.
I'm so glad we talked about that.
Well, and first I want to say I'm so sorry that happened to you. I'm so sorry.
Thank you.
And I think what's deeply hurtful is that you were vulnerable with this person.
Yeah.
And they took advantage of that, and they weren't transparent.
Yes.
And so one thing that I will shift for you is think about what I said about trauma-informed care that I provide. Think about that for yourself. You want to establish safety first.
Yes.
And you want transparency.
Yeah, because then that made me not want to date again. And that was like, you know, first in the sea, and now I don't want to go back in the sea again.
Exactly. Like you're not trying to yuck anybody's yum, but that's not your yum.
Yes.
That's not your yum. And that is okay that that's not your yum. That is your boundary.
Yes.
Unapologetic. That is your boundary. Unapologetic. That's you establishing safety and transparency. So now as it becomes clear to you what works, it'll be a lot easier for you to move forward in the dating life. Because then you're going to be like, nope, I'm not into being fetishized.
Yes.
And I'm going to walk slowly with you until I feel trust, transparency, safety, that you and I can have this bi-directional communication and reciprocity that's based on consistent and ongoing consent.
Thank you.
You're welcome.
Well, oh my God. Well, I guess that's like a good note for us to end on. I mean, before I do the outro, can you tell us where can everyone find you? Anything you want to plug, promote, you tell them because they need to hear it.
Yes, you can find me at uclogic.com, YOUSEE logic.com. You can find me at UCLogic on Instagram. That's my primary social. You please grab my book. Let me know what you think. Send me a review, email me, book a session with me. I would love that. And then I just also want to promote my colleague, Heather Edwards, who you all should follow her on Instagram.
Okay.
Heather Edwards Creation. She's a fabulous pelvic health PT, sex educator, sex counselor, and supervisor. We created a program for pelvic health providers, so MDs, PTs, OTs, nurse practitioners, on how to be intersectional, social justice framed in sexuality, sex counseling.
Fuck yeah.
So please check it out. If you are in the health professions, give me a shout. I'll tell you all about it. We're going to have Q&As and live sessions on that in the next month or so. Because we're letting in our 4th cohort starting in January.
That is fucking dope. And like low key, if that doctor situation that ever happens to me again, I'm gonna be like, here's a page you need to go to. You're gonna pull up, you're gonna pull them up, and you're gonna know. Yes, I love that. Well, you guys, that concludes today's episode of Stoned and Horny. Thank you so much for listening. Remember, if you want a chance to join the conversation, follow us on Instagram at Stoned and Horny Podcast. Leave a comment. Don't forget to follow us on all our other socials. And to stay updated with everything Stoned and Horny, I'm your host, Hayley Herms, and I'll see you on next week's episode.